Here at the European Cancer Congress in Amsterdam, Professor Awada from the Baudet Institute selected for Belgian Oncology News the highlights of the Congress. Professor Awada, thank you. What's new this year?
I think we can say that this meeting is a continuation of what started already at ASCO this year.
Let's begin maybe with breast cancer.
The two main messages from this meeting, at least, is one in relation to these new drugs of TDM1, which was compared to the best choice of investigator in a clinical trial. There is a trial presented by Dr. Wilders, and would show what we expect from this drug: improvement in progression-free survival of 3 months with very good tolerance. And I think the second message from breast cancer is, as you know, everolimus in combination with hormonal therapy in hormone receptor positive, or in combination with trastuzumab and navalmine in HER2 positive. We already heard about the clinical data, but now at this meeting we heard about the biomarker trying to look to predictive marker of sensitivity. I should admit I do not see really a major breakthrough in terms of clinical practice, but we started to see something interesting to predict sensitivity or resistance, but not yet really ready for clinical use.
Biomarkers were also very important in other types like colorectal.
What is clear that we are now beyond KRAS mutation in colorectal cancer. The people are looking to other marker in relation to this pathway. For example, NRAS, BRAF, and trying to precise much better the efficacy of existing anti-EGFR therapy.
Is there something new in lung cancer?
In lung cancer, there are two important, I think, information. We are already for ALK translocation patient in second-generation drugs, which seems to work to some extent in patient progressing on crizotinib. And I saw for the first time a phase 1 to some extent convincing on the efficacy in EGFR mutated tumor progressing on previous EGFR tyrosine kinase inhibitor. So we try, in particular, in this mutation called T790M mutation, which is really resistant to erlotinib and gefitinib.
Maybe another type of important cancer is renal cancer?
Yeah, renal cancer, we started at ASCO because, you know, the major question in renal cell carcinoma is how to sequence all this treatment. We have now at least 7-8 new agent, multi-target kinase inhibitor, mTOR inhibitor, and we don't know exactly what is the optimal sequence. Clearly, in third-line therapy, still there are possibility to use multi-target kinase inhibitor, even if the patient progresses on the first one. So we started to have the way how to sequence therapy in renal cell carcinoma.
What would be your take-home message?
I think this meeting is a little bit different from what we know. It's really a multidisciplinary meeting, and when we go to the program is a heavy program. There are a lot of sessions involving all the people, from surgery to radiation to medical oncology to nurses, and so is to some extent unique. One thing I would like to add about what we heard during this meeting, some new data about molecular profiling. Gene profiling as prognostic marker as well as predictive. For example, in colorectal cancer, 12 genes which could predict the bad or good prognosis colorectal cancer. We heard more on the Dutch study regarding MammaPrint and how to use it.
Okay, we thank you for this overview, Professor Awada.